Good day everyone. Today I am going to show you how to do Leopold's maneuvers. So, before performing the procedure, it is important to wash our hands, provide patient privacy, identify your patient using two identifiers like name and birthday, and explain the procedure for the patient's cooperation.
Good day, Mom. I am Jonaliza Aniban. I'm your student nurse for today. May I know your name and your birthday?
I'm like Armacasado and was born on December 16, 2006.
So today I'm going to perform Leopold's maneuvers. So is that okay to you, Mom?
Yes, Mom.
So before we start, do you want to go to the restroom?
No, Mom.
Next is I'm going to place the mother in the dorsal recumbent position and supine knee flex. This is to relax the abdominal muscles, and I'm going to place a small pillow under the head for comfort. Next is to drop properly the patient and maintain the patient's privacy. You just expose the abdomen. Rub your hands before placing them over the mother abdomen to gain comfort. First maneuver of fundal grip. It is the palpation of the frontal area to determine which fetal part is in the uterine fundus. It is also to determine the presenting part of presentation, the part of the fetus lying over the inlet. First maneuvers. I am going to stand at the bedside facing the pitch. So I'm going to place my hands on the abdomen just below the side where it presses, and then put and feel for the little part lying in the fundus. Second maneuver are the umbilical group. It is to locate or identify the fetal back in relation to the right and left sides of the mother and to determine the fetal position. And next, I am going to place my hands on the other sides of the abdomen, and the left palm is stationary on the left side of the abdomen to steady the uterus, and the right palm pits the right side of the abdomen on the circular motion from top to lower portion of the uterus. Applying gentle but deep pressure to palpate the fetal outline and the small little parts. Just like this. And after that, do it on the other side. Third maneuvers or Paulick's grip. It is to determine if the presenting part has entered the pelvis, and to find the head at the pelvis, and to determine the mobility of the presenting part. So, next is gently press the lower portion of the uterus with the thumb and two fingers of one hand, and pressing them together slightly, and make gentle movements side to side. For the findings in the third maneuver, the presenting part is not engaged if it is not movable. It is not yet engaged if it is still moving. For the final maneuver, or the pelvic grip, which side is cephalic prominence? Cephalic prominence is a part of the fetal head that prevents the deep descent with one hand. It is to determine the degree of the fetal head flexion or extension, to determine the attitude or habitus. The degree of flexions of the body head and extremities are the relationship of little parts to each other. It is also to determine the fetal descent. So the final maneuver, I am going to stand at the bedside facing the patient's feet. So, use the both hands, place it on the lower pole of the uterus, and then palpate it by pressing downward about 2 inches above the inguinal ligament. Just follow your fingers to be carried down. On the findings in the fourth maneuver, if descended deeply, only a small portion of the fetal head will be palpated. If cephalic prominence or brow or the baby is on the same side of the small fetal parts, the head is flexed, and if the cephalic prominence is on the same side of the fetal back, the head is extended. So that's all, ma'am. Thank you for your cooperation. Stay safe and God bless.